Stop what you're doing. Put your hands flat on a table or your lap with palms facing down. Look at them. The hands you see right now are telling you something about your body that your doctor never checked at your last visit, and that researchers at Hamilton, McMaster, and Oxford have now confirmed predicts how many years you have left more accurately than your blood pressure. If you are over 50, there are 5 specific signs visible on your hands at this exact moment that reveal whether you are already losing muscle, how fast you are losing it, and whether you are walking toward a fall, a fracture, or worse in the next 10 years. Hit subscribe and put your age in the comments. I want to know who is watching this. What I'm about to show you will change how you look at your own body for the rest of your life. Here is the truth almost no doctor explains. The first muscles you lose as you age are not the big ones. Not your thighs or your shoulders. The very first muscles your body sacrifices, often starting in your 40s and accelerating after 50, are the small intrinsic muscles of your hands. Why your hands? Because the brain triages muscle preservation by survival priority. Heart muscle, breathing muscle, and legs that keep you upright are protected the longest. Fine motor muscles in your hands are the first ones the body lets go. By the time your grip starts to weaken, the loss has already been happening for years. The hands are the early warning system. In 2015, a landmark study called the PURE study, led by Dr. Darrell Leong of McMaster University and published in The Lancet, followed almost 140,000 people across 17 countries for an average of 4 years. What they found shocked the medical community. A simple measurement of grip strength, taken in seconds with a small handheld device, predicted death from any cause more accurately than systolic blood pressure. Let that land. Your hands tell us more about how long you will live than the number your doctor obsesses over at every visit. Yet how many times has your doctor ever tested your grip strength? For most people watching this, the answer is 0. This is why awareness matters, because there are 5 specific signs on your hands right now that you can check yourself, in your own kitchen, in the next 10 minutes. That will tell you whether the muscle loss has already started and how serious it is. Let's go through all 5. Look at the base of your thumb. That fleshy mound on the palm side, just below the thumb joint, has a medical name. It is called the thenar eminence. It is made up of 3 small muscles whose job is to control fine grip, pinch strength, and the precision movements that let you button a shirt or pick up a coin. In a healthy 30 or 40-year-old, the thenar eminence is plump and rounded. You can press into it and feel resistance. It bulges slightly outward from the line of the palm. In a person with early sarcopenia, which is the medical term for age-related muscle loss, the thenar eminence is the first muscle group to visibly shrink. It hollows out, it flattens, the thumb joint and the small bones underneath become more visible. The press test shows soft tissue where there used to be muscle. I want you to do this right now. Hold one hand palm up in front of you. Press gently into the pad below your thumb with the index finger of your other hand. If it feels firm and resistant, your thenar muscles are still intact. If it feels soft, hollow, or you can feel the bone underneath without much pressure, you are already in early sarcopenia. Compare the thumb pad to the pad of muscle below your pinky finger, called the hypothenar eminence. In healthy hands, these 2 pads are roughly the same size. In sarcopenia, the thenar pad shrinks faster than the hypothenar pad, creating a visible asymmetry. This single test, which takes 15 seconds, is more revealing than most of the screening your doctor does at an annual physical. And almost no doctor over the age of 50 will tell you to do it. Now turn your hand over. Look at the back of your hand. You should see your knuckles, the long bones of the fingers, and the spaces between those bones. In a healthy hand, the spaces between the bones on the back of your hand are filled in with a thin layer of muscle called the dorsal interosseous muscles. These are tiny muscles that allow your fingers to spread apart and squeeze together. When they are healthy, the back of your hand looks smooth, with subtle muscle definition between the bones. In a person with sarcopenia, those small muscles waste away. The spaces between the bones on the back of your hand start to look hollow, sunken, or scooped out. You can see the long bones more prominently. Veins become more visible. The skin appears looser over the bony structure underneath. Look at your own hand right now. If you can see clear hollows between your knuckles, especially between the bones of your index finger and middle finger, this is a visible sign of interosseous muscle loss. The medical literature, including the work of Dr. Alfonso Cruz-Gentoft and the European Working Group on Sarcopenia in older people, identifies this exact finding as one of the earliest external markers of sarcopenia. Here is the cruel part of this. By the time you can see hollows between the bones of your hand, the same process is already happening invisibly in your forearms, your shoulders, your back, and your legs. The hand is just where you can see it without taking off your clothes. If you have a photograph of your own hands from 10 or 15 years ago, look at it. Then look at your hands now. If the bones look more prominent now, if the skin looks looser, if the hollows look deeper, your body has been losing muscle for years and nobody flagged it for you. Pause right now and write in the comments whether your hands look different now than they did 10 years ago. I want to know. Now I want you to do a functional test. This one tells us not just what your hand looks like, but what it can still do. Touch the tip of your thumb to the tip of your index finger, forming an O shape. Press them together firmly. Now try to use the index finger of your other hand to break that O by pulling apart your thumb and index finger of the first hand. In a healthy adult, the O should hold. The pressure should be strong enough that your other index finger struggles to pull through. In a person with early sarcopenia, the O gives way easily. The thumb and finger separate with minimal resistance. This pinch test, used in geriatric clinics worldwide, measures the function of the small intrinsic muscles we just talked about. If the test fails on both hands, you have already lost a measurable percentage of the muscle mass and strength needed to maintain independent function. Researchers at Newcastle University, led by Dr. Avan Ihisea, have shown that grip and pinch strength after 50 correlate with the likelihood of being able to live independently in your 70s and 80s. Weak hands at 60 strongly predict needing assistance with daily activities at 75. This is not a small finding. This is the difference between living in your own home and not. Test both hands. If one is significantly weaker than the other, and you are not aware of any specific injury that explains the difference, ask yourself whether you are using both sides of your body equally. Asymmetric muscle loss often points to asymmetric use, which is a separate problem we can talk about in another video. For now, just note what your pinch test tells you, honestly. Now look at your forearms. Hold both arms straight out in front of you, palms down, sleeves rolled up if you need to. In a healthy adult under 50, the forearm has a noticeable muscular contour. There is fullness between the elbow and the wrist. The muscles bulge slightly when you flex your hand, especially when you make a fist or extend your fingers. In a person with sarcopenia, the forearm looks thinner, the skin is looser, veins become more prominent because they sit closer to the surface as the muscle underneath shrinks. The contrast between the wrist and the mid-forearm flattens out. The forearm looks more like a long, thin tube than a muscle. I want you to compare your forearm to your upper arm. In a healthy adult, the upper arm is roughly twice the circumference of the forearm at the same body type. As sarcopenia progresses, the forearm thins disproportionately faster and the visual ratio shifts. If your veins look much more visible on your forearm than they did 10 years ago, even though you have not lost significant body weight, you are looking at muscle loss. The fluid balance and skin tension that hid those veins when your forearm was fuller are no longer there. Tommy Cederholm, a Swedish researcher who has spent his career studying age-related muscle loss, has documented that forearm muscle thickness, measured by ultrasound or visible inspection, correlates strongly with total body lean mass. In other words, if your forearms are thinning, the rest of your body is too. You can see in a mirror what most doctors would need a scan to detect. This sign, combined with signs 1 and 2, is often the most reliable early diagnostic of clinical sarcopenia available without medical equipment. Now the most functional test of all. The one that scared me into talking about this: go to your kitchen, find a sealed glass jar with a screw-on lid, pick it up, try to open it using only your hand strength. No rubber grip, no warm water trick, no slamming it on the counter. Just your bare hand. If you cannot open a standard jar of jam, a jar of pickles, a sealed bottle of olive oil that was just closed in the factory, your grip strength has fallen below the functional threshold defined by the European Working Group on Sarcopenia. The Cooper meta-analysis published in the British Medical Journal in 2010, which combined data from over 53,000 older adults across 14 separate studies, established the specific grip strength values that predict significantly higher mortality. For men, The threshold is approximately 26 kilograms of force. For women, approximately 16 kilograms of force. Below those numbers, your risk of dying in the next 10 years rises sharply. And the jar test is the everyday way to know whether you are close to those numbers without going to a clinic. Now here is the part that surprises most people. Grip strength below the functional threshold is not just about hands, it is a whole body signal. Dr. Tiina Rantanen, a Finnish researcher whose 18-year follow-up study published in JAMA in 1999 became one of the most cited papers in geriatric medicine, showed that grip strength at age 50 predicts mortality at age 75 better than almost any other physical measurement available. If you failed the jar test, this is not the moment to panic. This is the moment to act, because everything we have just discussed is reversible, partially or fully, depending on how early you start. One more thing about the jar test that should make you take it seriously. The functional threshold is not just about the jar itself. It is about what the failure of the jar predicts. Adults who cannot open a sealed jar at 60 have, on average, a measurably higher rate of hospitalizations, longer recovery times after any surgery, and a significantly greater chance of losing the ability to live independently in their own home before the age of 80. The jar is not the problem. The jar is the messenger. So you have done the 5 tests. Maybe you saw signs you do not like. Now what? First, and this is the one that nobody wants to hear, you need resistance training. Not walking, not yoga, not stretching, lifting things that are heavy enough to challenge your muscles. The research is consistent and overwhelming. Resistance training 2 to 3 times per week is the only intervention that reliably reverses sarcopenia at any age, including in adults in their 80s and 90s. You do not need a gym. You need 2 dumbbells, a resistance band, or even bodyweight exercises done with effort. Squats holding a heavy book, wall push-ups, carrying full grocery bags from the car. The principle is load. Your muscles need a reason to grow. Without that reason, they continue to shrink because the body sees no value in maintaining what it does not need. Second, the protein rule we covered in a recent video applies here directly. Approximately 30 grams of high-quality protein per meal 3 times a day is what the Phillips Research Group at McMaster has shown crosses the muscle protein synthesis threshold in older adults. Without that protein dose at every meal, your muscles cannot rebuild even when you train them. Third, vitamin D. Low vitamin D status, which affects most adults over 50, directly impairs muscle function and recovery. Get your level checked. If it is below 30, supplement. Fourth, sleep. Most muscle repair happens during deep sleep. If you are waking at 3 a.m. and not falling back asleep, your repair window is broken. We will cover that in the next video. Fifth, specific hand exercises. Squeezing a soft ball 5 minutes a day, spreading and closing your fingers against the resistance of a rubber band, carrying weights in your hands while you walk. These are small habits that maintain the very muscles you were testing today. And the 6th thing nobody talks about, daily protein you can grip with your hands, carrying groceries, lifting a full water jug from the floor to the counter, wringing out a wet towel. These are not exercises in the formal sense. They are the everyday loaded movements that previous generations did automatically and that modern conveniences have removed from our lives. The dishwasher, the elevator, the rolling suitcase, the prepared meal in a bag. Every one of those modern comforts removed a small dose of grip and forearm loading that used to keep our hands strong without us thinking about it. Reintroduce some of that load on purpose, and the muscle will respond faster than you expect. The Cooper meta-analysis and the Pure study both make this clear. Even modest improvement in grip strength after 50 produces measurable improvement in survival statistics. You are not stuck with what you have today. You are stuck with it only if you ignore it. Let me bring this together. 1. Check the pad of your thumb. If it feels hollow, sarcopenia has started. 2. Check the back of your hand. If the spaces between the bones are visible, the small muscles are already gone. 3. Do the pinch test. If the O gives way easily, you have lost intrinsic hand strength. 4. Look at your forearms. If they are thinner and your veins more visible than 10 years ago, total body muscle has been declining. 5. Open a jar. If you cannot, you are below the functional threshold the research says matters for survival. If 2 or more of these tests showed warning signs, you are not too late. but you cannot wait another 5 years to act. The bigger the muscle loss before you start training, the harder the climb back. The earlier you start, the faster the return. Almost no doctor checks any of this. The 10 minutes you spent watching this video and testing your own hands gave you more information about your real biological age than most annual physicals. In the comments, tell me how many of the 5 tests you failed. Just the number, 1 through 5. I read every comment. Take care of yourself. You earned the right to know this. And tomorrow morning, look at your hands again. Now you know what to look for.